medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. Welcome to the How to Stay Healthy show, here every Tuesday, or every Friday, I should say. We do a show on Tuesday, too. It's been a long week, but that's always good. We got a lot done this week. As you know, we're brought to you by All County Healthcare. Just want to say a couple great things about them, the sponsor. They are a home healthcare agency, Palm Beach County, Broward County, and Miami-Dade County. And they can answer any questions you have on Medicare, which is an important topic right now as it's open enrollment in Medicare. I think till the 15th. We had an expert on a few weeks ago. So you can always check out that show on All County Healthcare's website, allcountyhealthcare.com. Check them out on Facebook, Twitter, LinkedIn. And of course, they have their Facebook Live page, which we're on right now at All County Healthcare Incorporated. And if you have any questions, you can ask, give a call to 1-888-717-7170 and ask for Maddie. Like I said, she can answer any Medicare questions you have or home health care questions if you got a couple questions about navigating those organizations. But tonight, I'm really happy, made the drive all the way from Jupiter, which is, I got to give it to you, Doctor, because I just made a drive from Boca. That was one for the history books. But Dr. Louis Perezalonzo, and you are a ER physician, but you're also medical director of an ER department. And I've wanted to have an ER physician on for so long because you know what I've done in my life? I've made a lot of trips to the ER in my life, so I have a lot of questions. But welcome to the program.
Thank you for having me. I appreciate it.
Yeah, thanks for driving all the way up to Jupiter. I know you practice in Palm Beach and even Miami-Dade County, which we're going to tell listeners about.
Right.
But yeah, making that drive during the rush hour, I do appreciate it.
Oh, thank you.
And you've been really easygoing. I think I've asked you on the program a couple of times. You gave me a whole bunch of dates. So yeah, let's get right into it though, because I got a lot of questions. I'm sure the listeners do too. I'm sure you get this all the time, but what is the most common ailment that you see in the ER? I mean, you spent a lot of times in emergency rooms. Is there one common ailment that kind of stands out? I think that's every question that everyone has.
Yeah, people always want to know. You know, it's being in the ER, we see everything. We see it all, from the most common to the craziest things you can imagine.
Mm-hmm.
The most common things we really see are the abdominal pains, the chest pains. Those are the most common. Now, as we gear up and head into our flu season, we are starting to ramp up and see a lot of people with the common cold, some with the flu, but the abdominal pain and the chest pains for sure are the most common complaints we deal with. And most of the time they are, fortunately, it's a benign complaint. We do the workup, we do the CAT scans, the blood tests, whatever needs to be done. And we find that most of the time it's nothing too emergent. So fortunately, you know, everyone comes away fairly safe after the visits, and we don't find, it's very rare we find something very critical, but it does happen every day.
A lot of times you're the first line of treatment and you're the first figuring out that diagnosis, right, which I imagine can be pretty tough at times or easy, like you said, but because you've had a little bit more experience with a lot of these ailments. But I've been with a few family members, friends, and with just kind of out of this world ailments before, and I've always been impressed with the way emergency room physicians handle themselves, and people think you're there for a while, but when you're the actual patient, it doesn't feel like you're there by the time you get that diagnosis and all that. I mean, what I'm getting to is the ailments and the variety of ailments that you see. I would always think that question may be like from a car crash or some kind of broken bones, but it was interesting that you said abdominal and heart ailments. What's a typical work week like for an emergency medicine physician?
It's every job has its pros and cons, and one of the benefits of being an ER doc is you can almost create your own schedule of sorts. So the ER never closes, right? It's an open
That's
shop,
right.
24 hours a day, 365 days a year. So we got to find, people have to work at all times. So we can pretty much select the days we want off for the month, and then you have to give them certain availability, and from there you have to fill in and be flexible. So you're going to do some days, some nights, some weekends, but you can select your days off, which is the benefit. So if I have your friends and family going away on vacation in 2 months, and they tell you I'm going on vacation, you can tell them, okay, I'm in. You don't have to check if you can get approved and determine it later on. So there is some flexibility, but with that comes the necessity to work nights and weekends and holidays.
So you're a night owl. It's safe to say you're a night owl?
Not really.
No? But
I used to be. Now as my responsibilities have increased, I have to be around more in the daytime for administrative duties.
Yeah, let's talk about that. So you're an attending physician at St. Mary's Medical Center right here in West Palm Beach County, West Palm Beach.
Right.
Which is a level 1 trauma center.
Correct.
Okay. And then also you're now the medical director of the ER department at North Shore Medical Center. That's in Miami.
That is correct.
Okay,
right,
wow. So that's more of your administrative daily duty jobs. Maybe you're doing the scheduling and all that as well?
Yeah, there's, believe it or not, there's so much administration that's involved with these positions, with these emergency departments.
Mm-hmm.
There's always things that happened, stocking the schedule, developing new protocols, anything to kind of run the department smoothly. But there's issues, things you have to take care of on a daily basis. So I actually work clinically at North Shore as well. So in order to be an effective leader and to run the department, you have to actually be on the floor, see what it's like, feel the issues, and touch the actual patients to determine what needs to change, what needs to improve, or what's going well at the facility. So my role is 60% administrative, 40% clinical at North Shore. And when I work at St. Mary's, it is more of clinical, just actually treating the patients.
Mm-hmm.
So.
And that's a level 1 trauma center, so does that tend to be a little bit busier, more severe calls, or is that just kind of the stigma kind of behind that?
There's a little stigma. It's a fairly busy place.
Mm-hmm.
North Shore actually tends to be a little busier.
Really?
Overall.
I would have thought, yeah. That's what I was getting to.
North Shore is a little busier. We serve a different population, but we are the front door for a lot of people in the North Shore community.
Mm-hmm.
We're a lot of their primary care physicians of sorts. They don't have much access to the care, so we got more of we have a lot of primary care complaints at North Shore, so it is busier. At St. Mary's, we are busy as well, but it's not as much, and the trauma is a small component. Only is a small component of it. It is a trauma center, but there is a dedicated trauma team, and so it's not as busy as North Shore.
Now, and those are both North Shore Medical Center and St. Mary's Medical Center in West Palm Beach are both Tenet Health hospitals. Tenet Health has 10 hospitals across South Florida.
Right.
And an additional hospital right on St. Mary's campus is Palm Beach Children's Hospital, but it's part of St. Mary's Medical Center.
Correct.
So we do say 10. So there's 5 Tenet hospitals in Palm Beach County, 1 in Broward County is Florida Medical Center. As you know, we've had a lot of Florida Medical Center physicians on the program because it's in the proximity of Boca Raton where our radio studio is. And 4 in Miami-Dade County, Palmetto General Hospital, North Shore Medical Center, which is kind of North Miami, 95th Street.
Correct.
Right off I-95, really close to I-95. I've been there a few times.
Away. 2 blocks from
Yeah, and that hospital has got a lot of history too. A lot of history at North Shore Medical Center. And then also in Miami is Coral Gables Hospital and Palmetto General Hospital, and those are, and Hialeah Hospital right near Palmetto. In Hialeah. So that's the Tenet Health Network. Now, another question I want to ask you, really excited, as you can see, to have an ER physician on here because I've been in there, and I'm going to get to it in a couple minutes, some of the ailments, but I'm sure they'd rather listen to you speak first, though. What is there a certain kind of person that's an ER physician compared to an internist or orthopedic surgeon? I mean, is there a certain makeup that you men and women have?
I think there definitely is a different breed of person that is required to be an ER physician. It's more of a fast-paced environment. So you need someone who thinks on the spot, spontaneous, fast-acting person. Can get along well, gel quickly with a lot of different staff and different patients. And also someone who basically has very good bedside rapport, because you're going to interact with all sorts of people.
Oh,
so,
yeah.
Your
you never
bedside
know what
manner
you're
has,
getting either.
You never know what you're getting. So, or who you're running into. So, you meet some great people. You also run into some characters.
Just like life.
It's like life in general. So, we do this on a daily basis. Okay. So, it is a challenge, and it does require someone with a lot of perseverance and dedication to maintain the course and become an ER physician.
Are emergency rooms busier on full moons or when it's really rainy outside, or is that kind of a myth?
It's. I gotta say that myth might have some truth behind it.
Really? Do you know sometimes when you're driving in, you just know it's gonna be one of those nights?
Well, for the most part, we know all Mondays are bad. And
because people wait all weekend, right? We've heard that before from doctors.
It's the emergency department, but it's Mondays. We know every Monday it's gonna be full. There's no question about that. Some Fridays and Saturday nights tend to be busy, depending where you are. But the North Shore community tends to be pretty busy.
Okay.
But
that makes sense, yeah.
And full moons, like you said.
Yeah, that is interesting. And one important thing, and we haven't even talked about this before, but emergency rooms, they're the gateway to the hospital in a way. I mean, that's sometimes the only thing that some people see at the hospital. So you've got to run a pretty tight ship there, right? That is very important, correct?
Right. It is very important. It's important for the vitality of the hospital. At least at North Shore, about 80% of the admissions come through the emergency department.
Huh.
So we are the front line. Anybody falls, gets injured within the hospital, they're coming to us. Anything happens, it's the ER is responsible. So.
I know both of those hospitals that you're at, St. Mary's Medical Center and North Shore Medical Center, have won a lot of awards in the last few years. So you guys are definitely doing a great job there.
And North Shore just received the Leapfrog
grade
I
saw
A,
that.
so
that's huge.
It's one of the safest hospitals in the region, really, in the country. It's a grade A. So they look at 27 different factors to determine the safety within the hospital. As far as infection rate, mortality, morbidity. So it's quite an accomplishment to be graded in A.
Yeah, it's not easy to get that grade easy as well, because you never know when they're going to be checking your quality or whatnot. You got to kind of be on the ball 100% of the time to earn something like that.
And
I've read a lot about that.
It's a different world nowadays too. They're looking very closely at everything we do. So everything we document, every medication we give, our timing. So we're being looked at a lot closer. But it does help as far as make sure we decrease our mistakes and improve the safety within the hospital, which is the most important factor.
I think we got about a minute until our commercial break, but I just want to ask you. I want to ask you on the other side of the commercial to take us through a virtual tour of North Shore Medical Center ER, because I know you have a lot of new way of thinking, and I want to talk to you about the ER check-in as well. I think you have that at both hospitals, the ER check-in, which is something that's really popped up the last few years. And a little bit about why you chose emergency medicine. The toughest case you've had, but you don't have to be too particular. I know you can't be too particular. And the easiest case you had on the How to Stay Healthy show. We'll be right back and with Dr. Louis Perezalonzo. How to stay healthy. It's a question asked by many people and answered by few. On How to Stay Healthy with David DePino, I'm going to bring you the latest in health news by interviewing top doctors from South Florida and around the world. Tune in on Fridays at 5:30 p.m. right here on WWNN Radio 95.3 FM and 1470 AM, the Health and Wealth Network, to hear the latest health treatments and my curveball question of the hobbies and passions in life doctors pursue when not providing medicine.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. And we're back with Dr. Louis Perezalonzo, medical director of the ER at North Shore Medical Center and an attending physician at St. Mary's Medical Center right here in Palm Beach County, a level 1 trauma center. I want to ask you, why did you choose emergency medicine? I kind of feel like it's not something that every person would choose, but like we said before, you got to be a certain person.
It's actually the only thing I've ever wanted to do in my life is to be an emergency medicine physician. Even as little as being 7, 8 years old, I was in the Boy Scouts, grew up in Brooklyn. And again, my first merit badge was the first aid badge.
Oh, okay,
you know,
nice.
I always had a calling for medicine, and as time went on, I became an ENT at the age of 17 and handling emergencies, and that's just the passion I had, you know, just the adrenaline that you get from it, the rush, the unexpected when you walk into a scene. It's always something I've had a passion for. And just fostered from there. I continued on, and in medical school, I was head of the EMS department for the whole medical school. So yeah, it's just the passion. It's just something I love, and the rush that comes with it. And
where did you complete your education and training?
I did my training at Ross University.
Okay.
I was for a year, and then I finished up in New York. Did my clinical trainings in New York City.
Okay, so that's like attending physician at hospitals and whatnot? Is that
Oh no, but that's for medical school. And then,
that's before that.
That's before that, and then I went to University of Puerto Rico.
Oh, okay.
So, University of Puerto Rico is where I finished my residency.
Wow.
It was an amazing experience.
Okay. Yeah.
Amazing experience. You know, the way they clinically, like, the experience you get firsthand is it's unmatched. I believe. Yeah, it's a great experience.
Well, I'm sure Freddie's going to ask you after the program to be on his show because he's got the Brooklyn show, and he's I think from up there as well. But we'll get into that later on. What is the toughest type of case that comes into the ER?
I think the toughest case for most ER physicians is the cases that involve the kids, the pediatric cases.
Oh yeah.
You know, we do get these very critically ill cases, and for me, I can't forget the one case I had was trauma related during my training in Puerto Rico, where a mother got into a dispute with her husband. She didn't want the husband going out for his evening with his friends, and she threatened if he left, she was going to do something to the kids. And sure enough, the guy walked out, and she ended up, again, too graphic, she ended up stabbing both of the kids, setting the house on fire. And then they started arriving to the hospital. We started getting phone calls in the ER. We got burn victims coming in, we got stabbing victims coming in. And sure enough, 10 minutes later, they showed up in bad condition. And then you get both families coming in, the mom's family.
Oh, then you have to deal with that as well. Not only the care, but kind of...
It's a mess.
Yeah.
But it's sad, when you see, 2-year-old, 3-year-old kids. Actually, it was like 4 and 5-year-old in that case, but stabbed and burned. And, and you see the mom just sitting there, with a stoic face on, and you got to treat her as well because she tried to stab herself, so she becomes a patient. Those cases, you never forget the pediatric cases.
Yeah. And
they come in, you get the ones that are not breathing, the mom rolls over them, and they come in, respiratory arrest or cardiac arrest. You don't forget those, as a father, especially as a father, 2 young kids.
Yeah, I'm seeing that. I have a 5-month-old at home, so I'm seeing that for the first time. Definitely really changes your outlook on life. I'll tell you that, as everyone knows, as I've shared on the show. What's the easiest case that comes in or has came in?
Yeah, the cases that I love, the easiest cases, we get some of these, I don't want to say easiest, but the most rewarding in a way, and easy. Some of these reductions, what we call dislocations from extremities. You get something called nursemaid elbow when the kid comes in and their elbow's out of place.
Where you can pop it back in?
Out of place and got to pop it back in. It's a quick, easy thing. but you quick and easy, and kids back to normal, the patient's back to normal. It's a great feeling.
That's amazing that men and women of the ER do that, because I don't know if I could do that. The feeling of popping back in a joint, but I know you've done it many times. I'm sure you're going to do it again. Let's talk a little bit more about the ER. I wanted you to take us through a little virtual tour, but before that, there's a new thing the last few years is, and I see it on your website, is the ER check-in. So you can actually check into the ER before you leave the house if it's not as an emergent of a situation,
Right.
where you would maybe check in and maybe not have to wait in the waiting room kind of thing, or maybe not have to wait as long.
It does speed up. It's not necessarily an appointment, but it does get you in, and it does save you time. We know you're coming, number one, so we can prepare for it if necessary. Okay, if you tell me, especially if you're coming in with something that's a little more time intensive, you can come in. We can prepare for you ahead of time, and it does save time as far as registration, because they're going to ask you some of these demographic questions, your address and phone number, and if that's already in the system, it does save you time while you're in the hospital. So it can certainly prepare us a little better. So
That's great to know.
it's not used as much. And really, if it's an emergency department, if it's true emergency, like you said, you're not going to sit there and register online. But it is available, it's accessible, and it will save you some time if you'd like to use it.
Yeah, I saw it on the front of both websites. It's a little more prominent on North Shore's. If you want to check that out, just type in North Shore Medical Center in the Google taskbar, or I think it's northshoremedcenter.com. I'm going to check though, and I'll give it out before the end of the program. Now, both hospitals have that you're on staff at. What is the senior ER? Because I saw that for North Shore I think North Shore Medical Center had that on their website. Is that a special way of thinking, the senior emergency room?
The senior emergency room is an area of the emergency department, and North Shore was created basically for senior citizens, the geriatric population, the elders, to make it safer and more comfortable for them. So they have rails to hold on to while you're walking, phones with larger numbers to press, more comfortable bedding, private rooms. So they, North Shore took their time and invested in a certain section of the emergency department to make it easier, more friendly, more comfortable for that population.
Oh,
Since we serve a great number of seniors in that community.
That's a great idea, because as I've talked about on this program, I know one of the main things that can happen to seniors in terms of injury is falls.
Right.
So you really have to, you're really thinking out of the box when you're putting like the foam on the railings and whatnot, because fall risks are huge with seniors. I mean, I actually lost a couple people I've interviewed, because I'm a journalist as well, from falls. So that's something that you're thinking ahead about. And so the senior ER is at North Shore Medical Center as well. What are your hobbies and passions outside of medicine? I mean, you seem to be pretty busy with family and attending physician at St. Mary's, and then medical director as well.
And most of the time I spend it, I'm quite busy, but my free time I do spend it with my kids mostly, who are here in the studio with me now.
They sure are.
But I'm coaching football.
Okay.
I do a little coaching of football, flag football with my kids. My son. And my daughter's now involved with basketball as well, so we do some basketball training.
Oh, good.
So do a lot of traveling with the wife and kids. And we go up north a lot. Most of our family's still up in New York, New Jersey area. So.
Okay, nice. And you're a resident of Jupiter.
I'm a resident of Jupiter. We just moved there 2 years ago. Beautiful place.
And as the listeners know, I lived in Jupiter for 30 years. I'm actually from Jupiter. It's a
very nice place.
It is a great town, and a town I'm trying to get back to. And we were talking a little bit about that. I actually I took a job down here right out of college, and it was at the Sun Sentinel, and it was for the Delray beat. And but little did I know, the Sun Sentinel actually at the time was in Deerfield Beach, and then my office was down on Green Road, and I guess that would be South Deerfield Beach area. So I actually started looking years ago. I ended up in Boynton because gas prices at the time, I was telling you, were like $5.25 a gallon. I was spending half my paycheck to drive from Jupiter down here. So I'm glad that gas prices are low for you, because you got to drive to from
a lot of miles.
Yeah. How many?
It's like 90 miles.
90 miles. Wow.
Yeah, that's why I kind of work in both places. But the drive down is not bad. 5 in the morning. I leave my house at 4:45, get down there by 6.
This is when you're the medical director.
As
This
medical-
more of an administrative role, a little more than.
Well, my
than
clinical
attending
shifts are at
physician.
6 in the morning, so they start at
okay.
6. Yeah, we switch over at 6.
How long is a normal clinical shift for an ER physician? So you start at 6, and how long would it go to?
6 to either 4 p.m. or 6 p.m. So either 10-hour or 12-hour shifts.
Okay.
Most places are in that range, 10 to 12-hour shifts.
Okay, so that's pretty mandatory everywhere.
It's not mandatory. You find some 8-hour shifts in certain
Yeah.
places, very few places, but for the most part, 10 to 12-hour shifts is the norm.
And it seems like when I'm watching the physicians in the ER, they're bouncing from room to room. Do you ever get a break in that 10 to 12 hours or no?
For the most part nowadays, no.
Yeah, you're always on your feet too.
ERs are very busy places for the most part nowadays. So, and you have to be up and down because you got to check on the patients and give them the results and see the new patient and find out what's going on with the X-ray and CAT scan. And so you have to bounce around. It's
Yeah, I don't run into a lot of ER physicians that are overweight or anything. And here's a textbook example. You're in pretty good shape because you're always on your feet, right?
We're always up and down for sure.
Yeah, as well.
So a friend of mine took his did the Fitbit and he said he walked it was 8 miles in the shift.
Whoa.
So
I believe it because, like I was telling listeners, I've been in the ER a few different times. Actually, recently, I just went over the hump of 40 years old, and I was playing basketball with my friends, and buddy undercut me. I went down, broke 2 ribs, and broke my foot in the same fall.
Wow.
But that ER physician, that was actually at Delray Medical Center around the corner. He was great as always. I've never had a bad experience in the ER. I mean, you guys go above and beyond.
Thank you.
What kind of happens there though in the ER when so I'll be the patient here. I'm in the exam room. I got the broken ribs. You're kind of working on the computer, coming up with a diagnosis, looking at the MRIs, maybe even looking into the electronic health records. A primary care physician, if you had to contact in some cases, is that kind of what happens in that period?
Right. As soon as you come in, take your stuff from right when you arrive to ER. You come in, you get screened by a nurse initially. Right away, we try to have a mid-level provider or a physician see you right away, make sure you're stable, medically stable. Then we'll come back. We'll put some orders in depending on your condition, and we'll go from there. We analyze all the results ourselves, and we look at the X-rays and radiology, X-rays and CAT scans, and then we wait for the radiology to give us official interpretation as well, and then we diagnose you, give you a diagnosis, a plan, and we'll give you follow-up.
Now everything's connected on electronic health records. That's great.
We like to follow up with our patients after as well. So.
Well, thank you so much for coming on the program. I
Thank
hope
you for having
come
me.
again
Thank
as
you
well.
for having me. It's been a
I
pleasure.
appreciate it.
Thank you so
for your
much.
time.
Thank you so much. Thank you.
See you next time on the How to Stay Healthy show. For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.